Okay, so this presentation, we're going to talk about both the nervous system and special senses. There's quite a bit of information here that you need to know about. There's a lot of things that I want you to learn. So some of your learning goals is to identify the four main parts of the neuron. You want to know the main divisions of the nervous system. There's two of those. And then the function of the five parts of the brain. You're going to need to understand the functions of the spinal cord, the names of the different meninges. You're going to describe the circulation of cerebrospinal fluid, understand the difference between the sympathetic and parasympathetic nervous systems, as well as, of course, some of the diseases associated with the nervous system. And then when we talk about special senses, I want you to identify what the special senses are. You are not going to have to know all the parts of the eye. We're going to talk a little bit about them, but you won't have to diagram them specifically. I do want you to understand a little bit about hearing, as well as, a little bit about taste, and then just that general sense of sensation, being able to feel, etc. So the nervous system, extremely complex. There is a lot to know about the nervous system. Certainly we're not going to learn everything we need to know here, but it's important to understand that it is very complex. It's going to coordinate most of the activities of the body, and it allows the body to respond and adapt to all those changes that occur both externally, outside of the body, and also inside the body. So the functional unit of the nervous system is called a neuron, and it has several different components to it. It's got the cell body, the nucleus, and then the nerve fibers, and we'll talk a little bit about those. So here, when we talk about the nerves, you can see this picture here with the dendrite, and then there's a nucleus. This would be the cell body, and then the myelin sheath along the axon, and then the terminal branches. Now, when we talk about these nerve fibers, I want you to understand that the dendrites are going to receive the impulse, and then the dendrites are going to carry it to the towards the cell body, and then the axon is going to be that single nerve fiber that is going to carry the impulse away from the cell body down to the terminal end, and then it's going to, here at the terminal end, it's going to then kind of connect through a synapse, a little junction, to the next cell and their dendrites, and then so it just keeps going back and forth along. So nerves are combination of all these nerve fibers going throughout the body, and nerves are located outside of the brain and spinal cord. And we have afferent and efferent nerves. Afferent are sensory nerves. They're going to carry the messages up towards the brain. Efferent are motor nerves, and they're going to carry the message from the brain, then whatever the brain wants the muscles to do, it's going to carry, or the other things, it's going to carry that message there. And then the associative, these are going to carry messages. There's two main divisions of the central nervous system. We have the central nervous system and the peripheral nervous system. And then within the peripheral nervous system, we have two divisions, and the central nervous system would be the autonomic nervous system and the somatic nervous system. So the somatic nervous system is going to carry impulses between the central nervous system and the body, whereas the autonomic nervous system is going to control involuntary body functions. So the main components of the brain are going to be the cerebrum, the cerebellum, the diencephalon, the midbrain, the pons, and the medulla oblongata. Now, the cerebellum, this is the section, I'm trying to, hopefully, I don't know if you can see this, I'm hoping you can. So the cerebellum, this is, or I'm sorry, the cerebrum, we're going to start there. So this is this big main section. It's the largest section, and it is responsible for reasoning, thought, memory, and judgment and speech. The cerebellum is going to be down here, and the cerebellum is responsible for coordination of muscles and balance, posture, muscle tone. The diencephalon, so that's located between the cerebrum and the midbrain, and it has the thalamus and the hypothalamus. So the thalamus is kind of a relay center and directs sensory impulses to the cerebrum, and then allows conscious recognition of pain and temperature, whereas the hypothalamus is going to regulate and control the autonomic nervous system, as well as temperature, appetite, water balance. It also helps with sleep, constriction and dilation of blood vessels, and is involved with emotions like anger, fear, pleasure, and pain. The midbrain is located below the cerebrum at the top of the brainstem, and it is responsible for conducting impulses between the brain parts and then for certain eye reflexes. And the pons, which is located below the midbrain, is responsible for conducting messages to other parts of the brain, and then also some reflex actions like chewing, tasting, producing saliva. It also has some assistance with respiration. The medulla oblongata, this is the lowest part of the brainstem, and it connects with the spinal cord. So it's responsible for regulating heartbeat and respirations, and swallowing and coughing and blood pressure. So that medulla oblongata, that lower brainstem, if that is injured, has severe injury to it, that really is pretty detrimental. Now, when we think about the rest of the central nervous system, and thinking about the spinal cord, we know that the spinal cord is going to continue down on from the medulla oblongata all the way through. It's going to go all the way through the vertebra, and it's going to go all the way down to the sacrum, and it is going to carry sensory or afferent messages up to the brain, and then carries those motor or efferent messages down the nerves out to the extremities and the body outside of the spinal cord. Spinal cord and the central nervous system is covered by three membranes. So these are called the meninges, and there's the three parts of them is the dura mater, the arachnoid membrane, and the pia mater. And so what these meninges do is they cover and protect the brain and spinal cord. The dura mater, that's the thickest outer membrane, and then the arachnoid membrane, this is real delicate web-like layer. It's real loosely attached to the other meninges, and this allows space for the cerebrospinal fluid to flow between the layers. The pia mater, the innermost layer, attaches very close to the brain and spinal cord, and this also is going to contain the blood vessels that are going to nourish the nervous tissue. So the central nervous system, the brain has these four spaces, and they're the ventricles. They're hollow spaces, and they connect with each other and with the arachnoid membrane via the subarachnoid space. Now they're filled with this clear colorless fluid, and this is cerebrospinal fluid. And what this fluid does is it circulates through the ventricles, it circulates through the subarachnoid space, and helps serve as a shock absorber to protect the brain and spinal cord. Also, it carries nutrients to some parts of the brain and helps to remove metabolic products. So in a way, it functions very much like blood does in the rest of the body. Now, when this fluid is done, when it's kind of after it's been circulated, it gets absorbed into the blood vessels, so the dura mater, and then returns to the bloodstream. But this is a clear, colorless fluid. And when you think about if you've ever been ill and I had to have a spinal tap, or you've seen it in a show or whatever that they're doing a spinal tap, they're always wanting to see that fluid clear. If it's not clear, that can be not a real good sign. It means that there's something probably as far as bacteria or viral going on inside there, and that is not where you want to have a virus happening. So when we talk about the peripheral nervous system, we're looking at the cranial nerves and the spinal nerves, and then the autonomic nervous system also is in there. And the somatic nervous system, this is what the cranial and spinal nerves are. So there's the 12 pairs of cranial nerves and their branches, and they're responsible for many of the special senses like sight, hearing, taste, and smell. And then others of them just receive general sensations like touch, pressure, and pain. The spinal nerves, there's 31 pairs of those, and they carry messages to and from the spinal cord. And they're both afferent and efferent. So afferent, again, is those sensory nerves, whereas the efferent are the motor nerves. We have 8 cervical, 12 thoracic, and 5 lumbar, 5 sacral, and then 1 pair of coccygeal spinal nerves. And each of these nerves is going to go to a specific part of the body. So if we end up with a break somewhere along in those spinal nerves, like in the spinal cord, or severe damage, depending upon where it's at, we really can get a pretty good idea of what's going to happen in relation to complications or loss of function. The autonomic nervous system is broken down into 2 parts. You have the sympathetic and then the parasympathetic nervous system. The sympathetic nervous system, we call that our fight or flight nervous system. So this is what's going to give us super speed. It's going to increase our respiratory rate. It's going to increase our blood pressure, our heart rate, and it's just going to get us moving quickly. Our parasympathetic nervous system, this is kind of the balance to the sympathetic. It slows us down. It increases circulation to the digestive organs. Our muscles kind of relax. It just kind of slows us down. So I think of the parasympathetic nervous system as kind of our turkey dinner nervous system, whereas the sympathetic would be our superhuman nervous system. So there's several different diseases that we're going to talk about. We're going to talk about ALS, and this is also known as Lou Gehrig's disease, amyotrophic lateral sclerosis. It is chronic and degenerative and neuromuscular disease. We don't really know the cause, but we think that there might be a viral component or an autoimmune kind of component. This disease is progressive, and it is terminal, and oftentimes people don't survive very long. Now, we do have some that have lived up to 20 years after diagnosis, but that's a pretty small percentage. Carpal tunnel syndrome, this is a progressively painful hand and arm condition, and what happens is we've got some medial nerves and tendons that pass through this tunnel in the wrist area, and with repetitive movement, we end up with some inflammation that impinges that nerve. So we can either do physical therapy, we can splint the wrist, and then sometimes, anti-inflammatories might work, or surgery. Cerebral palsy, this is a non-progressive, so it's not going to continue to progress, disturbance, and this is caused by brain damage, usually lack of oxygen to the brain or some birth injuries. It can also be caused by, for example, if the mom gets rubella while she's pregnant, it can lead to that. And what happens is there is some exaggerated reflexes or maybe seizures. There can be speech impairment. There can be spasms and tremors, and there can actually be some mental retardation. There's no cure, but they do some treatments, some supportive treatments, physical therapy, and things like that. A CVA is a cerebrovascular accident or stroke, and you're going to learn in your CPR class how to identify signs of a stroke. There's two basic kinds of a stroke. There is a hemorrhage stroke, so this is bleeding in the brain, or there's an occlusion stroke, so a blood vessel gets blocked to the brain and the brain can't get the nutrients and oxygen that it needs. Stroke is if it's recognized early and intervention happens early. Sometimes, you can have some fairly positive outcomes, but stroke can be devastating and just kind of really damage the function of the brain. Encephalitis, this is an inflammation of the brain. It's usually caused by a virus or bacteria, but you can also have encephalitis because of chemical agents or complications of other viruses. Encephalitis, we're going to have to treat whatever the cause of the encephalitis is and then monitor. Sometimes there can be some permanent brain damage, though. Epilepsy or seizure syndrome, this is a brain disorder associated with abnormal surges in electrical impulses. And there's different kinds of seizures that people can have. They can have absent or petit mal seizures. And in this, people just kind of look off into space, whereas that generalized grand mal or tonic-clonic seizures, those are what we kind of think of as seizures. It's where people are kind of spasming or moving around. They might, losing consciousness. They might become incontinent of bowel and bladder. And we're going to talk a little bit more about that again in our CPR first aid class. Hydrocephalus is called water on the brain. So what happens is that cerebrospinal fluid accumulates. It's not being absorbed into the vascular system like it should be. And sometimes what they can do with this is they can actually put a stent in and drain that fluid somewhere else. Now, if this occurs early and they identify it in utero, they can actually go in and do surgery to help alleviate some of that. It can lead to mental retardation and some cognitive disabilities. Meningitis is inflammation of the meninges of the brain and spinal cord, usually caused by bacteria, virus, or a fungus. It could be some other chemical toxins. This can be very, very serious. Death can be an outcome here. So we really want to make sure that we are being immunized against those things that can cause meningitis, as well as making sure that we're, thinking about what those symptoms are. So symptoms can be high fever, a headache, back or stiff neck, nausea and vomiting. And if we start seeing people moving into delirium or convulsions, that's pretty scary. This we need to get treated immediately. Muscular sclerosis, this is a chronic progressive condition. What happens is there's degeneration of the myelin sheath in the central nervous system. Usually occurs between ages of 20 and 40. We don't really know the cause, but we know what's happening. So as that myelin sheath degenerates, we can end up with things like visual disturbances or weakness, poor coordination. There can be some numbness and tingling. And then later on, you can get tremors and muscle spasticity, speech impairment. Treatment, there's different medications out there now that they're using, some of those biologics, but we also do a lot of supportive stuff with physical therapy and muscle relaxants, things like that. Neuralgia just simply means nerve pain, but neuralgia as a diagnosis is nerve pain without a stimulation to the nerve receptor. So it can be very difficult. There's many different causes. So post-herpetic neuralgia, so after you have shingles, it can cause that. You can get neuralgia associated with nerve damage from diabetes. And again, oftentimes it's supportive, but there are many medications that they can use also. Paralysis, this is where you lose the function of your voluntary muscles. This occurs generally because of brain disease or spinal cord injury. And we have terms associated with, for example, hemiplegia. This is where you have paralysis on one side of the body or the other. Paraplegia, this is paralysis in the lower extremities. Quadriplegia is paralysis of the arms and the legs. At this point, there's no cure, but they're really making some huge strides in this depending upon the cause. So again, treatment's going to be fairly supportive. Parkinson's disease, this is a chronic progressive condition. It involves degeneration of the brain cells. We generally see this in people over 50. There's a lot of different drugs that they're using to help alleviate some of the symptoms, but nothing that can cure it at this point. And then shingles or herpes zoster, this is a disease, again, that leads to oftentimes some severe pain, but we'll see that shingles rash breakout. It's caused by the same virus that causes the chickenpox. Usually treatment is supportive of that. You might use some antiviral medications if it's caught early. Some people end up with awful post-herpetic neuralgia. So we've talked about a lot of different things in regards to the nervous system. We're already 21 and a half minutes in, so you can pause it here if you need to for a break for a minute, and then we're going to talk about the special senses. So the special senses that we're going to talk about, what they do is they allow our body to react to the environment. So when we think about special senses, we're talking about the ability to see and hear, taste, smell, to maintain our balance, all those kinds of things. One of the special senses that we think about is the eye, so that's our vision. And there's, what happens with the eye is there's light rays that get transmitted into the optic nerve, and then that carries the impulses to the brain, and then they get interpreted, and that's what we have as sight. We have many different parts of the brain, or excuse me, many parts of the eye, and you're not going to need to be able to label the eye from your memory or anything, but you do need to understand some of these different components of the eye. So the eye's pretty well protected. There's that bony socket it sits in. We have the eyelid and eyelashes. These help to keep various floating things out of our eyes or keeping debris out of the eyes. The lacrimal glands or tear ducts, these help to protect the eye. There's actually an antibacterial component to that. And then the conjunctiva is the mucous membrane that protects the eye, and also has lubrication that helps that eye stay, There's three layers of the eye. There's the sclera, which is the outer layer, the choroid coat, which is the middle, and then the retina is the innermost. The sclera is made of tough connective tissue. It's the white of the eye, helps maintain the shape of the eye, and also has the cornea, which is that transparent part of the front of the sclera. This is what allows light to enter the eye. The choroid coat's the middle layer of the eye. It has a lot of different blood vessels associated with it, and nourishes the eye. It also has the pupil, so that's the hole in the front, and the pupil allows light rays to enter in. The iris is a special part of the choroid coat. This is the colored portion of the eye, and it is a muscle that controls the size of the pupil. So it gets bigger or smaller, letting more or less light in. And the retina, this is the innermost portion of the eye. There's lots of different layers of nerve cells there. And it also has the optic nerve. There's two special kinds of cells in the retina that helps us with sight. We have the cones and the rods. Cones are mainly used for light vision. They're sensitive to color. And the rods, these are used mainly for dark or dim vision. So we talked about what the iris is. It's the colored portion of the eye, and some muscle. And the pupil, that is the actual hole that allows light rays to go in and out. The lens is what is going to cover the eye, and the lens helps give us vision and gives us sharp vision. So it refracts or bends light rays so that we can focus things. The aqueous humor is clear watery fluid. It fills the space between the cornea and the iris and helps maintain forward curvature. The vitreous humor, this is the jelly-like substance, fills the area behind the lens and helps to maintain the shape of the eyeball. And then, of course, we have various muscles that are going to allow the eye to move, as well as the pupil, constricting and then dilating. So some conditions associated with the eye, we have amblyopia. This is lazy eye. It occurs oftentimes in early childhood and can result in poor vision, so there's lots of different treatments they can do for that. Astigmatism, this is where you have a warping or an abnormal curvature of the cornea, and that is going to disrupt vision, and you'll need corrective lenses for that. A cataract, normally your lens is clear. What happens with a cataract is it becomes cloudy or opaque, and so we can do great surgeries with that now. Cataract surgery is so much different. It used to be if you had your cataracts removed, they had to keep their face down for days and days and days. Now you're up and moving around just very, very quickly. The conjunctivitis, this is pink eye. This is it's a highly contagious inflammation condition, usually caused by a virus or bacteria. It can lead to redness and a gritty sensation in the eye. Now, there is a contagious conjunctivitis, which would just be caused from allergies. Treatments, depending upon the cause, might be antibiotics, or it might just be some allergy medication. Glaucoma is a condition of increased pressure inside the eye. It's caused by excessive amounts of aqueous humor, and we see this generally later in life. It depends on the cause of the glaucoma as to how we're going to treat it. Sometimes it's easily treatable, sometimes it's not as easily treatable. Hyperopia or farsightedness, this is where your vision is disrupted. You can see things far away, but when they get up close, they're blurry. Whereas myopia is nearsightedness, so here you can see things near clear, but you can't see things so far away. Macular degeneration, this is a progressive cause of vision loss. It's one of the major causes of vision loss and blindness. And again, there's a couple different types. There's dry macular degeneration and wet macular degeneration, and depending upon what type you have and the cause is really going to impact your outcome and treatment. Presbyopia. Presbyopia is farsightedness associated with age, just because the lens loses some of the elasticity. So farsightedness, again, we can see objects far away, but we can't see up close very well. And so that's where you see people using their cheaters. But again, this is related to age. And strabismus, this is a disorder where the eyes are not moving or focusing together. So one eye might move inward, people might look cross-eyed. There's lots of different treatments that they can do. So they like physical therapy or visual training, muscle exercises and so forth. So many different things we can do. There's a lot of different conditions of the eye. And by the way, a specialist in the eye, so a physician that specializes in the medical diagnosis and treatment of an eye, is called an ophthalmologist. When we think about the ear as an organ of special sense, this is the one that controls our hearing and balance. So it's not just hearing, it's balance also, and that's a huge concept to think about. What happens when we're hearing, we get sound waves, and the sound waves get transmitted through the auditory canal, and then it's going to carry those impulses up to the brain, and then the brain interprets them as hearing. There's three major sections of the ear. We have the outer ear, the middle ear, and the inner ear. The outer ear has the pinna or auricle. That's kind of what you see on the outside. We have the auditory canal. That's the canal that's leading from the outside of the body up to the tympanic membrane. And then the tympanic membrane, this is what separates the external ear from the middle ear, and it vibrates when sound waves hit it. In the middle ear, we have the three small bones, the malleus, incus, and stapes, and these bones together help to transmit sound waves to the inner ear. There's also the eustachian tube here, and the eustachian tube is a tube that connects the middle ear to the pharynx or throat. If you have a bacterial or viral infection in the throat, it can travel up the eustachian tube, and then you can end up with a middle ear infection. The inner ear has, this is the most complex portion of the ear. And there's various different components to it. You have the oval window, the vestibule, and the cochlea, the organ of Corti, as well as the semicircular canals. And each one of these components have a specific function in hearing. So the oval window, this is a membrane that separates the inner ear from the middle ear. The vestibule is the first section and kind of acts as an entrance. The cochlea looks kind of like a snail shell, and it's going to continue. It contains these delicate hair-like, projections or cells that help it receive and transmit impulses. And then the semicircular canals, also located in the inner ear, and they contain liquid. And as we move around, that liquid kind of goes back and forth, and so this really helps us to maintain our balance. This is how our brain knows where we are in relation to the world. So those semicircular canals, really important for equilibrium. Various different conditions that we have. We have hearing loss, and we classify hearing loss as two different types. We have conduction hearing loss, and then we have sensory hearing loss. So conduction means that something's impinging those sound waves from getting conducted to the inner ear. There's all kinds of things that can do that: ruptured tympanic membrane, or it could be wax, infection, various different things. Whereas sensory hearing loss, you have damage to the inner ear, the auditory nerve, and so it's much harder to get that hearing repaired. Meniere's disease, this is a condition of fluid in the labyrinth or of the inner ear, or where we don't have those hair cells that are in there, they're degenerating some, and so you end up with severe vertigo or dizziness. There's various different things they can do to treat Meniere's disease. Sometimes it's medication, sometimes it can be some different types of exercises. They use some physical therapy to treat some of this. Otitis externa, this is a condition where you've got bacteria or virus in the external canal, and we think of swimmer's ear with this one, or damage to it, like if you put a bobby pin in it. Treatments generally things like antibiotics or anti-inflammatory drugs. Otitis media. Otitis media is inflammation in the middle ear, and again, depending upon the cause is how we're going to treat it. Generally speaking, we're going to be using antibiotics for something like that. And then otosclerosis. Otosclerosis is where the stapes becomes immobile, and so you end up with a conductive hearing loss. There's hearing aids might be able to help, bone conduction hearing aids, and there's some other treatments that might be able to, and surgery might be an option here. Another taste that we have, or another sensation we have is the sense of taste. We have taste receptors that are located on the tongue. We have four main types of taste. We have sweet and salty, and that's at the tip of the tongue. Sour tastes are the sides of the tongue, and bitter taste is at the back of the tongue. So we have these different tastes. Now, another taste that they talk about is something called umami. Umami is kind of an overall taste sensation that is just kind of unctuousness or goodness. And it's very important to remember when we're talking about the sense of taste that the sense of taste is strongly influenced by the sense of smell. So the organ of smell for us there is the nose. We have these olfactory receptors in the nose and the nasal cavity, and they're going to carry impulses into the brain. A lot of this is a chemical thing, so we're getting these chemicals out of the air, and that's what's triggering our sense of smell. Our sense of smell is more sensitive than our sense of taste, and our nose can detect over 6,000 different smells, which I think is amazing. However, if we cannot smell, if you lose a sense of smell, your sense of taste is going to be really impaired. They really do work very well together. I don't know if you've ever smelled cinnamon. So if they have it at Christmas, they have those cinnamon brooms out. And when you walk by them, not only do you smell the cinnamon, but you can actually taste it in your mouth. You haven't even put anything in there, but you get that taste of cinnamon. Now, the last thing we're going to talk about is the skin and general senses. We have different receptors in the skin. So we have pressure and heat and cold and touch and pain receptors in the skin. They're all going to be receiving things from the external environment, helps us to respond to the environment. For example, if I put my hand on something hot, it's going to tell me to move it. There's various different things that can affect these different diseases, but they're going to be pretty numerous, so we're not going to discuss a ton of those here. So we have looked at a lot of different things in this presentation. It's been a little bit long, 36, almost, well, by the time we're done, probably 37 minutes. A lot of additional information that I've talked about, and you are responsible to know that. So you can either go back, re-listen to this, or make sure you read your chapter well.